Thank you to the witnesses for coming today to testify about MK Ultra. Dr. Genexi, you said you worked for the NIH, is that correct?
That is correct.
And you left in 2025?
That is correct.
I noticed during your opening statement that you had nothing to say about the content of this hearing being about MK Ultra. Your statement seemed to be based more on your issues with this administration's attempt to reform and rein in the NIH. Is that a fair assessment of your opening statement?
My opening statement was talking about the destruction of the NIH and cancellation of grants and political control of the NIH.
Would you deny that the NIH had involvement in the funding of the Wuhan lab?
I don't have any knowledge about any funding related to the Wuhan lab.
So are you denying that the NIH?
I'm basically
the
here to
Wuhan
talk
lab?
about what's happening right now at the NIH and how we really should be letting science be driven by scientists and not by politicians.
Well,
because that's how we fund cures and make health progress.
Well, with all due respect, ma'am, do you find it ironic that for years we were told to trust the science, and then in the aftermath, we've all found out that most of what we were told during COVID was a complete lie, and it wasn't scientific at all?
The number one thing that I think that we're doing to destroy trust in American science right now is canceling clinical trials. In the middle of those clinical trials, this does incredible harm to the patients who are receiving experimental treatments, and it really destroys the trust that we have in how do we recruit patients for future trials if they are knowing that their trials could just be simply canceled for political reasons.
Right. I don't think anybody up here would deny that there's never been anything good that's come out of the NIH and that you guys have done some good work, but you just brought up trust. Do you think the NIH has a trust problem based on how they handled COVID?
No, I do not. I think that the NIH is beloved by the American people because we know about the advances in human health and cancer treatments and heart disease and diabetes and all of the health gains that the research has produced.
Well, I think you're wrong, ma'am. I think the public has a serious mistrust issue with the NIH. Do you deny that the NIH tried to cover up the origin of COVID?
I'm not here to testify about that. That's not my area of science. I have no knowledge of that.
Do you believe that the NIH supported masking and social distancing when there was really no science to support that?
What I'm more concerned about is what's happening right now to destroy the Biomedical Research Institute that has been the envy of the world. And right now, we're ceding our leadership in biomedical research to China. That's what's happening right now.
What about covering up harmful side effects of vaccines and the role that the NIH has played in that? What do you have to say about that, ma'am?
The U.S. history of human subjects protection has evolved greatly. Numerous research improprieties from the 50s to the 70s in the United States, including the Tuskegee syphilis study, forced Congress to establish formally federally
I'm not asking you about
mandated rules.
You know what I'm asking you about? I'm asking you about how NIH handled COVID. Obviously, this is supposed to be a hearing about MK Ultra, but when you gave your opening statement, and I don't even know why you were called to this hearing because you didn't offer anything about MK Ultra. But since you are here and you're going to defend NIH, I'm going to call you out on it. Do you see now what I'm talking about when you say that the NIH doesn't have integrity problems and trust issues? Did you hear the applause in this room? That should tell you right now that you're pretty tone deaf to what the public thinks about how the NIH handled COVID and the cover-up, not only the funding of it, but the cover-up involved in the aftermath. Can you acknowledge that?
I'm sorry, that's not my understanding.